We're here with Randy Parker, who's the CEO of MDLive here at the Forbes Healthcare Summit 2014. I just want to start asking you, the company does telemedicine, telehealth. Telehealth and telemedicine, as a journalist who's covered the industry for such a long time, healthcare, it's always been one of these things that's like kind of out there, and is it coming, and there's a pilot project, and then it doesn't go anywhere. But you're here to tell me that it's going places now. So let's talk a little bit about that.
Yes, absolutely. So obviously telemedicine has been around since the Apollo missions, and it has been a disruptive pushing a rock up a hill. We started the company MDLive back in 2009 to really look at not just specifically telemedicine, but how we could use technology to improve the quality of healthcare costs and also quality by using technology to provide that to consumers.
Super. So walk me through how this would work, and I know you guys have been really growing rapidly. So as a patient and a physician, walk me through how MDLive would work for me.
Certainly. So it really operates in any modality of choice, preferable mobile, but it can work in any way. You can call a call center, you can use our mobile applications.
Telephone app?
Telephone, mobile app, a desktop, it works on all different formats.
Excellent.
And what you're doing is that it knows exactly where you are, so either through the geo-targeting or through where you're located, and you fill out medical history. And then once you fill out the medical history and your chief complaint, you would be connected to a board-certified, highly trained telemedicine physician who is licensed in the state where you are at that time. You would do either a face-to-face video or phone medical interview, and that provider would then either treat you if appropriately, or we would do what we call check you in to allow you to be referred to a physician for a physical appointment.
And so a lot of times in the past, one of the concerns with telemedicine is that, I may want this, but my insurance company might not pay for it, so I would have to pay out of pocket. How is the reimbursement structure set up for the physicians to get paid and for the consumer to have help paying it? Is it mostly still a private pay, and how open is the insurance industry to this?
I think we're at a perfect storm where in many cases, because of Accountable Care Act, we are at a point where both the technology and the payers who are providing reimbursement have accepted the fact that there is an inflection point, and the use of telemedicine today is a requirement to provide more efficient access to care. The reimbursement from the patient or consumer perspective operates in a very similar way than it would if you would go to an urgent care center or a primary care office. And in all cases, the actual fees, which range around $50 or less, are less than it would be for an average copay. 20-something states in the U.S. require reimbursement for a telemedicine visit
from the insurance
company itself, and most insurance companies who are using this in the past as a pilot program are allowing this to be a covered benefit.
That's good. That's a new phenomenon.
It is a new phenomenon. The other phenomena is the shift of the self-insured employers in the U.S., which there are over 90 million that are now taking risk and who are mandating that this be a covered service for their employee population. So we have over 700 corporate employers.
Can you give me some of the examples?
Who use these services, and from their employee perspective, if there's a copay set, it just operates the exact same way it would be to go to a physician office.
So the office visit, so if I paid, so for the employer, they're probably paying what, half of what a traditional office visit would cost? Or could you talk a little bit about the cost differences in that?
Exactly. So the out-of-pocket expense for a co-payment perspective, which would be about 50% of what it would be to go into a primary care office, the employer or the payer, because of the positive advantages of making sure that the consumer is going to the lowest cost and the highest quality, inadvertently not having them inappropriately going to the emergency room when they don't need to go to the emergency room, the cost savings are large from that perspective, but the copay out of pocket could be, we have customers that have zero copay, and we have others that have $10 or $20 copay. The lower the copay incentive, the more that the employee will use this or consumer will use this service.
And give me an example of the kind of things that I would use it for. I mean, personally, if you have kids, you're thinking, and the services are around the clock. Tell me a little bit about the services that are generally used for MDLive for telehealth.
It's a low acuity today, urgent care type of condition, pink eye, coughs, colds, upper respiratory infection type of conditions, similar to the things that you would get at an urgent care center where you do not need to actually have a physical exam, would be the type of cases that we work on today.
So if I'm going to use this service, is there also video consultation as well? Can the physician see me, or where all do you think this is headed? A lot of people think historically telemedicine might be phone conversations. Are we going to get into other areas?
Yes, and so the ways that the consumer can view themselves and the physician more specifically are through the face-to-face video encounters. And that will allow, one, the consumer to actually build a trust and a relationship with the actual provider. We also have the ability for skin rashes to be able to take snapshot pictures and securely sending them so that the physicians can actually see different types of scenarios in that way.
And so, where do you see this headed more broadly? I mean, are there, you mentioned the relationship, are there people that are now using this service so much that they can get the same physician again, or how is all that working?
The way our system works is that they have the choice of either doing an on-demand visit, which they would then get the available physicians that are licensed in their area that are set up to be able to provide these e-visits. Or they can actually choose an actual provider, see their CV, see where they went to school and everything about that physician as well, so they get to choose. Our position is that medicine is local, and it is important for this to scale to make sure that you can actually see a physician virtually when that's appropriate, and when you need to see them in person, you can do that as well. So we work to build the network using local providers and health systems so that we can connect those consumers virtually when that's appropriate for light touch, and for heavy touch when they have to be seen, that we can actually have them go to those same physician networks inside their local communities, and that's a game changer.
Yeah. And one more question, you can talk a little bit about the market out there. There are other players in the market. If you could talk maybe just a little bit about that. I mean, what's the penetration of telehealth? And I could see other big nonprofit systems getting into this as well.
So I think that we're at an inflection point with telemedicine. As you said before, it's been around for a while, but we are definitely at an inflection point where the use of this is becoming not only convenience, but a required use of this because of the additional people that are going to be able to have access to health care and the shortage of primary care physicians in the U.S. as they exist today. The competitive landscape and the opportunity that we work is going to obviously also expand as time goes on. The government and CMS just recently, last week, suggested that for CMS, they're going to allow reimbursement for certain capacities of telemedicine. So as we now can provide that to Medicare, CMS, and Medicaid programs on the government side, that's where this becomes certainly much more mainstream.
That's great. Well, Randy Parker, with the CEO of MDLive, I mean, the development of telemedicine is really hitting its stride, and talked about Centers for Medicare and Medicaid Services even getting into this. It's something we haven't seen before. Thanks so much for coming to the summit.
Thank you.